Hello, my name is Christina. I'm going to be your nurse today. Can you give me your first name and last and date of birth, please?
Tabitha Sack, August 9, 1995.
Perfect. Are you allergic to anything, any latex or medicines?
No.
Okay. Are you in any pain right now?
No.
Okay. Patient has no obvious signs of illness. Her grooming and hygiene look well kept. She looks healthy. Do you mind telling me where we are?
The exam room at CHP.
And approximately what time it is?
8 o'clock.
Okay. Patient is alert and oriented ×3. She knows where we are and who she is. Her mood is appropriate. Her speech is clear and steady. And now I'm going to move to your head and your face for our head-to-toe assessment, okay? Okay, I'm just going to feel around your head for any lumps or lesions or anything, which she doesn't have. Okay. Her skin color is proper for her ethnicity. And I'm just going to feel for your temperature. Her temperature is warm, her skin's dry. Now I'm just going to point to certain places on your face with your eyes closed. Just tell me what they are, okay?
Cheek. Chin. Cheek. Forehead.
Okay, perfect. All right, now can you smile for me? Frown. And puff your cheeks. Okay, those are cranial nerves 5 and 7. There is no obvious signs of drooping or anything at her face, mouth, eyes, anything like that. Now I'm going to move to your eyes. Do you mind taking your glasses off for me? Thank you. Okay, her eyes are symmetrical. I'm just going to shine a bright light into them, okay? Okay. Now follow my pen. Perfect. Okay. Now I'm going to test your peripheral vision. Just tell me when you see my hand. Perfect. Her eyes are perla. Her pupils are equal, round, reactive to light, and accommodation. Now I'm just going to pull your eyelids down, okay? Her conjunctiva is pink and her sclera is white. Okay, now I'm going to, yeah, you can put your glasses back on. Thank you. Now do you mind opening your mouth for me? Okay, her oral mucosa is pink and moist. Her tongue and uvula are both midline. Her tonsils are about a 1+. Her gums are intact and pink and moist, no lesions. Her teeth are white with no signs of any cavities. Thank you. Now I'm going to move to the neck. I'm just going to feel for your pulses, okay? Okay. Her left carotid is a 2+. And so is her right. Okay, now I'm going to listen to them for any bruit. When I put my stethoscope bell at different points, just hold your breath for a few seconds, okay? Okay, I'll let you take a little breath. And same thing for the other side. Perfect. Thank you. Okay. Now we're going to move to the upper extremities. I'm just going to feel for your temperature again. Her temperature is warm, her skin's dry, her color is proper for her ethnicity. Do you mind holding your arms out just like that? Perfect. Okay. Her radial pulse is a 2+ and equal bilaterally. And her brachial pulses are a 2+ and equal bilaterally as well. Okay. Fingers, thank you. I'm just going to push down on a few to test for capillary refill, which is less than 3 seconds. Now, do you mind holding your hands out just like that? Perfect. There is no nail clubbing. Do you bite your nails at all?
Yeah.
Okay. Now, last thing I need you to do is grab onto my hands and squeeze them as hard as you can. Perfect. Thank you. Her strength in her hands is a 5+. Okay. Now I'm going to move to your heart. I'm just going to point to the different areas first. Thank you. Here is the aortic. It's at the second intercostal space. The pulmonic, also at the second intercostal space, but on the left. herbs, third intercostal space on the left, tricuspid, fourth intercostal space on the left, and the mitral, which is at the fifth intercostal space at the midclavicular line. Okay, now I'm just going to listen to those points. Up here at the aortic and pulmonic, you'll hear more of the S2 sounds. And at the tricuspid and mitral, you'll hear more of the S1 sounds. Okay, now I'm going to stay at this mitral area for about 60 seconds for the apical pulse. Okay. And now I'm going to switch over to my bell and just go reverse up. Perfect. Okay, now I'm going to listen to your lung sounds and tap different places on your chest and on your back. Now every time I put my stethoscope in a new place, just take a deep breath for me. Okay, I'm going to listen to your side. And the other side. Perfect. Okay, now we're going to move to the back. And same thing with the breaths. Okay, now I'm going to move to the side. And to the other side. Perfect, thank you. Okay, and while I'm back here, I'm going to look at your thorax and sides, okay? Alright, I'm going to kind of hit you a little bit. Just let me know if you feel any tenderness. No? Okay, perfect. Do you mind leaning forward just a little bit? Thank you. Okay, her spine is midline, no bulges or anything. And now I'm going to look at her side. Her A and P diameter is 2 to 1. Okay. Now do you mind laying down for me? I'm going to look at your abdomen. Okay, the order for the abdomen, you have to first inspect, then auscultate, and then percuss and palpate. So I would look for any scars, the contour of her stomach, make sure everything's in order, there's no bulges or anything, and to make sure her umbilicus is midline, which it is. Now I'm going to listen to your bowel sounds in each quadrant. Okay, she has bowel sounds in each quadrant. So now I'm going to percuss over each quadrant. You should mainly hear tympanic sounds, except over the liver where it would be dull. Perfect. And now I'm going to palpate for you. In the left lower quadrant, you would have the cecum, the appendix, the right ureter, and the right ovary because she's a female. In the right upper quadrant, you would have the gallbladder, the liver, the head of the pancreas, and the right kidney. In the left upper quadrant, you would have the spleen, the stomach, the body of the pancreas, and the left kidney. And in the left lower quadrant, you would have the left ovary, the left ureter, and the sigmoid colon. Okay, now as she sits up, I'm going to test for JVD, jugular vein distension. Go ahead and sit up for me, which she does not have. Okay, now I'm going to move on to your lower extremities. I'm just going to feel for your temperature again. Her temperature is warm. And do you mind taking your shoes off for me and socks? Okay, now I'm just going to feel for your pulses. The popliteal, which is a 1+ and equal bilaterally. The dorsalis pediis, which is a 2+ and equal bilaterally. and the tibial pulses, which are also 2+ and equal bilaterally. And while I'm down here, I'm going to test for edema around your ankle and shin, which she does not have, on the right or the left. And her skin is also dry, warm, and proper for her ethnicity. Okay, also while I'm down here, I'm going to kind of tickle your foot a little bit for the Babinski test. So that is a negative Babinski test because her toes did not curl. Okay, do you mind standing up for me? We're just going to do the last bit of the assessment. Do you mind walking to the door and back? Okay, perfect. Oh, stay like that. Okay. Do you mind putting your feet together, arms at your sides, and closing your eyes? For about 20 to 30 seconds, I would see in here for the Romberg test, see if she gets dizzy, leans to one side, or anything. Okay, perfect, thank you. Now, did you feel any dizziness at all when you were walking?
No.
Okay, her gait is steady and equal. She's not favoring one side or the other. Now, do you mind sitting on this stool? Okay, did anything hurt while you did that? Okay, and stand back up one more time. All right. Did you feel dizzy or lightheaded at all?
No.
Okay, perfect. She is steady while sitting and standing as well. That is the end of my head-to-toe assessment.